Today marks the start of Mental Health Awareness Week, and to kick it off, the Center for Addiction and Mental Health is launching an awareness program.
I can't breathe. I have migraines, numbness, weight loss. I live with it every day. The illness that I'm suffering from is an anxiety disorder, and it deserves to be treated like any other illness.
Former NHL goalie Corey Hirsch and President and CEO of CAMH Dr. Zahn are fighting to end the stigma around mental illness, and they join us now. Thank you both for being here this morning.
Yeah, no, it's an outstanding initiative, and we're just happy to be here to be able to get the word out there, get things across, and hopefully end the stigma.
Absolutely. Doctor, you co-authored an op-ed that you called it Mental Health is Health. What do you believe is the biggest problem in our country so that we can get over this stigma?
Well, if you think about the statistics, about 20% of Canadians, about 6.5 million Canadians, have the experience of mental illness. Yet only 2% believe that this is a pressing health issue. That's a big deal. And part of that is this marginalization or separation of the world of mental health from healthcare in general. That has been historical, and it is multifactorial, but it's been a big problem for us, and the concept of mental health is health should be read just as you hear it on the surface. This should be part of the healthcare system.
Sometimes the best way to get that point across is to hear people's personal stories. Corey, you have one of those yourself. You were a goalie in the NHL in your 20s when you realized something was wrong. Can you tell us about that moment when you realized that there wasn't something right?
Well, no question. I mean, it's a long time ago now, but just trying to get into the National Hockey League, and I was out with some friends, and it was almost like something just kind of broke, is the best way that I can describe it. And years later, I would be diagnosed with obsessive-compulsive disorder, but at the time, I didn't know what was happening. So for me, it's about getting the information to their children, because if I could have known these things in school and I'd have been able to get help at that time and knew what it was, early diagnosis is the key. And early intervention, you can get so much better, and getting help and being able to reach out and get help.
Well, see, and that's the thing that sticks with me when you say years later I was diagnosed. And I'm sure there are a lot of people who suffer, they know something's wrong, they feel, as you said, something's broken, but it takes years before they can get to a place where either someone notices or they themselves seek help. What, in your case, was the sticking point that prevented you from seeking that help early on? Well,
being a professional athlete's part of it, right? You don't want to show a weakness, or there's a lot of shame, guilt attached to mental health, and the stigma. The stigma was, I mean, so wow, this is, it was real, and we're changing it, the movement. My children, their generation, hopefully, we've started the talk about ending the stigma. My children's generation, hopefully, will end it, because people need to be able to know that it's like any other issue. It's like having a sore shoulder. You go see the doctor, but why, when it comes to mental health, we don't want to reach out and get help?
Doctor, what else do we need to do to move that needle on that 2%? Only 2% of Canadians who view it as a pressing issue? Do we have to remind them of the financial costs or benefits? What is it, what on top of education and reaching out can we do?
Well, Ben, we talk a lot about stigma, prejudice, and discrimination, but the facts are that there are excellent treatments, evidence-based treatments for a variety of sorts of mental disorders. And the first thing is we need to improve access to care. So we need to have a call for funding by our healthcare system that is equitable, that matches the burden of illness in our society. And there is a lot of mythology surrounding the treatments, but in fact, they are as effective, in many cases, as effective as treatments for things like congestive heart failure. So we have to improve access to treatments that we know work, but there also has to be a significant investment in research into mental health, because there remain a lot of people who do not respond to the current treatments we have available to us.
And Corey, I'm going to guess that things have been getting a little better. From the outside looking in, you've got guys like DeMar DeRozan, Kevin Love, both all-stars in the NBA, who've recently been very vocal with their struggles with mental health. Do you think things are getting better on the professional sports front?
Yeah, absolutely. I think it's been, the movement really has been remarkable. And when I came up with my story, I was terrified of what the response would be. I've had nothing but overwhelming love and support from people, and the comments have been extremely positive. So reach out and get help. That's kind of you can get a lot better.
Well, I want to thank you both for being here today. We really appreciate it. Good luck to both of you.
Thank you.
Thank you.
All right, after the break, oil is trading above $70 a barrel for the first time since 2014.